Hi, I'm Dr. Nandita Palshetkar and you are watching my YouTube channel where I'm going to be talking about infertility. I am been practicing IVF for the last 30 years. I'm the medical director at Leelavati Hospital IVF Center, at Mohali Fortis IVF Center, at Delhi La Femme Fortis IVF Center, and Dr. D.Y. Patil Hospital IVF Center at Navi Mumbai. And today we are going to, I get this question every time. What is the difference between IUI and IVF? What should I do? Whether I should do IUI or why am I doing IVF? I think this is a very important question because these are the two simple treatments which are available for infertility. So in IUI, what we do is the creation of the baby is inside your own body. In IVF, we create the baby in the lab, in our lab. It's outside your body. So that is the basic difference. So everybody will say IUI is more like natural. Yes, it is. It is what we do in IUI is we give you tablets and injections so that you produce 1 or 2 eggs only. We don't want more eggs. So ye eggs grow ho rahe ki nahi, we find out by doing sonography. And once the sonography is done and we see the eggs are ready, we give an injection and then call you into the hospital, say Leelavati Hospital in Mumbai. And there we ask your husband to give us a semen sample. So he masturbates and gives us a semen sample. This semen sample is then processed in the lab. Once we process this sample, what happens is we give it, khana pina khilate hai. We feed it nutrients and get out the best motile sperms, improve the motility of the sperms. There are different technologies today to get the sperm for IUI. Previously, we used to do a very simple treatment of double density gradient or density gradient. Now there's microfluidics, there's MAC. All these technologies are available for IUI. So this is like a mini IVF, sometimes we call it. And this IUI has a success rate of only 10 to 15%. That is the difference between IUI and IVF. IVF has a success rate of 50% and IUI has a success rate of 15%. That is because, everything has to happen in the body. So what we do is we take these sperms and then put it in the body of the girl, timing it with the egg rupture. So this is very important. And then naturally after 15 days, we tell you to have relationship that night and the next night also. So you should have relationship with your husband that night and next night. And remember that the sample that the husband gives us should not be more than 4 or 5 days old. So it's very important to throw away the sample while your process of ovulation induction is going on and when the sonographies are going on. So this is IUI. The IVF treatment is very simple also. It's like an IUI, but only difference is we give injections for 10 days and the sonographies are done. And then instead of allowing the egg to rupture in the body, what we do is we go in with a needle and remove all the eggs out of the body. This is a minimally invasive procedure known as ovum pickup. You're under anesthesia, so you don't get any pain. And we go to the ovary and remove all these eggs. Then these eggs are taken into the laboratory, IVF laboratory. And in the IVF laboratory, we take your husband's semen and your eggs and we put them together and fertilize them. And then we have the babies. So in IVF, the ready-made baby is put back into your womb. And that is why the success rate is 50%. And if you do 3 or 4 IVF cycles, the take-home baby rate is definitely as high as 80 to 90% in good prognosis patient. That means in patients who are young, who have a good ovarian reserve, who have good uterus. And if there are problems, then a little bit the success rate drops to about 60%. If the person is very old, if the person is, having a less number of eggs, if the sperm count is very, very poor, like 1 million or 2 million count. So all these patients are poor prognosis patients. Or the uterus has adenomyosis, it's a bad uterus, a thin endometrium. So now there are different techniques which are available to us to improve the endometrium. So this is the difference between IUI and IVF. And I think those patients who don't conceive with IUI, 2 to 3 cycles of IUI, I will definitely advise them to go for IVF. So which are the patients who can go for IUI? First of all, ovulation, you have to have eggs, so ovulation can be done. Second is the semen count should be more than 10 million count. It should not be less. If it's less, then we have to go for IVF or ICSI, as is known as advanced IVF. Then the third thing is the tubes have to be opened. The tubes have to be open for the sperm and the egg to meet. So all these factors need to be there. If any of these 3 factors are a problem, we do IVF. So as I mentioned before, in IVF, in my previous video, I've talked about indications of IVF, that is blocked tubes, low AMH, failed IUI or IVF, then male factor infertility. If the problems are with the man, definitely IVF is indicated. And of course, if you have any hereditary diseases which you don't want the child to inherit and you have to do genetic diagnosis of the embryo, then we do IVF.